let's just focus on this first, because this is important as well. All right, this is called handoff for patient experience training. So the goal here is to describe what a patient experience is, what does it look like, how does the patient experience either help or hinder the office, and where does the patient experience take place. Right, so there's different places within the practice, and as a patient comes in and through the office, that we kind of just want to make sure that we're doing this right. So the handoff is how the patient goes from one department to the next, right? From the front to the back, from the back to the hygiene, to the doctor, from the doctor back to the hygiene assistant or hygienist, from hygienist to the front or assistant to the front, right? So all these handoffs and transitions that take place in the office. Another part of the patient experience is the morning huddle. So we're going to do a huddle. We have to do a mock huddle today too. So I'm going to have to hurry through this thing because the huddle is important. Huddles help us. Doctors need to be here for the huddles. So everybody has to be here 15 minutes beforehand, right, to get everything set up and ready for huddle. You may need to look at things the night before. You're going to pull all your patient information and know the things that you need to know. Okay?
No worries, just a drink.
Okay, so daily huddle prep for the hygienist. Joy, I guess this is covering all the daily huddle stuff too. Do we have anything on the huddle stuff or not? Is that the huddle, that's huddle right there? Can we pass that out to everybody right quick and just give it to them?
So you said 15 minutes before?
Ooh, I'm gonna
Thanks.
be hustling.
Is that, do they show up 15 minutes prior, Joy?
15, well, I usually, so we
Hygienist?
start off at 8, we start rolling in around 7:30, finishing.
But I know Dana's really particular about how
She has them
soon.
a half hour before.
A half hour before, not
And then
before
we
that.
start huddle.
You can come in
15
30,
minutes
you can
prior.
come in 30 minutes prior to your,
You
Correct.
can, like that's what we're allowed to, or would you
Yes.
want us to?
That's, I mean, technically, if you have to stock your room,
7:45
7:45.
Okay, so
sharp.
everything needs to be set up before, okay.
Yes.
Well, because before, like, we couldn't be here until 8 o'clock.
I know. So we're okay with you guys being here at 7:30, but not before that.
Okay.
So does that mean that both me and Amy come in at the same time now? Because we staggered. Because
Yes.
like
we
on Mondays and
staggered too.
Tuesdays, I was coming in at 7:30, and then she would come in at 8:30. And then vice versa on Wednesday and Thursday.
Yeah, that means we both have to come in.
I would have,
Do I need
I'd rather have you
Oh,
guys
to get to
first
that.
here. So you
Yeah,
get used
keep
to
it all
doing
together.
huddle and kind of, I'd like to create a little bit more of a cohesive team and process. So if you guys can both be here, so you have team meetings and huddles and you guys start prepping for your days and know what's going on, that's better. Okay, if we want to think about that down the road, fine, but I think that's good.
There's too much new stuff for us all to get used to right out of the gate. Probably best if we're all here.
And everyone's gonna need help.
I don't leave my house until 7.
So, look at tomorrow's, so they're for your hygienist, right? You guys, I don't know if you guys already do a lot of this stuff, maybe you do, but look at tomorrow's schedule and make sure the appointments have the correct and necessary procedures attached to them, right? So your appointments have everything attached, right? Your x-rays, your prophy, your perio maintenance, your fluoride, your varnish, whatever needs to be in there is correctly attached to your appointment, right? And then add in whatever treatment is incorrect, right? You see that sometimes, sometimes it's right, sometimes it's wrong. Look at any unscheduled treatment plans in the route slip, determine if the patient is due for an FMX or
Can we,
vitamins.
can we close
and make
that?
sure
That's shining right in my face. The sun. Did it bother you?
Jim was going to me earlier.
Ugh, it did bother me for like. Sorry, thank you.
I will pay
Yeah. Oh yeah, much better.
Another samples of route slip.
Perfect.
We usually close them.
Carl, you head back there, dude.
I have to say that once.
You do? There you go. All right. So look for opportunities, right? If you see, if there's different things in the patient that you're aware of, maybe they were interested in cosmetics before that you know, or the patient had any, if they went on vacation that you knew about last time, or their kids were joining a basketball club that you want to ask about, personal things, anything you can make the visit more personal, or anything that you think should be brought to the doctor's attention, right? Okay, for assistant, so are there any special circumstances today to remind the doctor of in the huddle, right? Is there any allergies? Is there anything that you're aware of? do we have current bite wings and PAs, right? Along with any intraoral camera pictures of crown preps today, for today. Do you guys take pictures of crowns before you prep them or not?
PAs,
PAs or
or
orals.
Either one,
Sometimes both,
Sometimes we try for both.
if you do. It's not bad to have a picture of that crown, sometimes they deny them. The pictures that she will like those pictures to get correct, to get stuff paid, your intraoral camera's okay there, right? It's not really for
Anything.
patient education, but just a photo that's in the chart that she can grab, different from the extraoral camera.
Any teacher in work on it. We don't have
Okay,
it.
so make sure if you guys, so height assistants, you guys should know that before you go in there to prep the teeth, and before you prep some, grab some pictures if you need one. When you take your pre-op, grab a photo of it, right?
You have to have a PA every single time?
Yeah.
If it's
Before and
an old
after.
one, if you're prepping a tooth, I need a PA because insurance are gonna need PAs about that teeth, they do, especially if it's a redo. Then I need oral,
That
intraoral
PA
pictures
is
if I
better than
can.
wings.
yes,
They
yes.
like PAs better than
Yes.
wings? Okay, all right.
I've had them reject
And
because you've
that's-
had bite wings. PA is enough,
You have
And
to have an
they pay on
apex
that
and a
PA
PA.
too, so
Yes,
it's
$17.
additional money, right?
depending on the insurance.
Right,
Yeah.
okay.
You need the apex and the PA also, please. Don't cut off the.
Okay, and then like we discussed too, they have their next continued care appointment, right? So is the next hygiene appointment scheduled? If not, make sure you guys are trying to capture that while you're in the chair with them, right? You want to schedule that chair side. Okay, when's the best time in your emergency to see, and to see an emergency in your column today, right? Okay, daily huddle prep for patient care coordinator. Joy really does this one, but then I'm kind of helping here. Prepare to report everything you know about any new patients on today's schedule, and determine through each central report who needs cell phone email addresses from. So, anything that you know specifically about the patients, that's kind of your contribution. Anybody that you need, try and do your research, and if you need email or cell phone, try and pick that up when they come in. OM, look at the financials, right, of today's patients to make sure that the patient can be seated, you don't have to collect anything, right? You want to have your dollar signs or people circling you need to collect from on the schedule today, correct?
So before they get seated, their balance should be 0, if they have a balance.
Great, good.
Um,
I like that.
Okay.
Yes, if
Which
you
is
have a
that.
chance, go grab and say, Mr. Jones, I noticed you had a balance of $350. Can we go ahead and take care of that before your appointment today?
Do they have to take care of it before their appointment? I think is what she's asking.
Yeah,
Just ask them. I mean, if they say, no, I want to do it after, okay, fine.
okay.
Most of you just
And then
ask them,
just
they
let them know how
don't
much
care.
it is again. You know, so they can get it after.
And
Let them
do you
walk
guys
away.
have signed treatment plans for each of your patients?
Yes.
And then you have to, and then I want you to come to and say, hey team, here's where we're at so far this month. We've produced $10,000 so far this month. Our goal is $111,000 to bonus. So here's where we're at. And your job is just kind of tell them every day, here's where we're at.
But that'll just be for them.
Yeah,
Well,
yeah. I mean,
But
No.
collective production.
yeah. So I mean, you guys help with that production too, right?
Yeah.
Your production helps the team too. Okay, doctor, you guys just come and just try and give some positive statements. Just be here. If you're just freaking here for the actual huddle,
Be here on time.
you'll be doing a good job,
involved.
okay?
Half the doctors don't make it.
No, they're just lazy, they don't care. So decide if there's any special circumstances for these patients you need to comment on or discuss with the team, all right? If there's anything that you guys want to be aware of, or somebody was upset last time, or stressed out about, or the lab case didn't fit, I don't know, whatever you guys want to just share with your team. Okay, so now we're going back to handoffs. I don't know why I kind of had the thing in the middle on huddle. We're going to go back and do huddle, but now let's talk about handoffs a little bit. So communication within the office team, perception is reality. So when somebody comes walking in the front door, we're going to go through the whole process here. Patient comfort, having someone with them throughout the experience. Does the patient feel comfortable in our environment? Do they feel comfortable as they're going through the office? Same day treatment opportunities, all staff needs to be on the same page and always aware of where opportunities lies. It's why morning huddle is important and what's happening during the day. You can't really take care of your patients and everybody knows what's going to happen during the day. Oh, and then handoffs are really important because you verify treatment completed in the next step that's done. So when you guys set complete in the back, I was reading a report in Dental Economics that mentioned that up to $50,000 a year. They said the average the practice doing $1 million a year loses $50,000 a year just because stuff isn't set complete in the practice management software. So when you do a crown prep, if you're prepping tissue away, right, you're doing a gingivectomy. I fail at this a lot. I just don't do it. If you see a big deep cavity in there and you go in there and you prep it and you have to blanch the tissue and
What
spend all
was
this
Dr.
time.
Novelli using to get the tissue out of his way? Would he use his burr when he's prepping to get the tissue out of the way, or is he getting out a laser or
We had an
electrosurge? or-
electrosurge, but he didn't have a lot of patients.
If you do that, then you should be charging for a gingivectomy, right? And the gingivectomy should be on post set complete in the back, right? So there's a process to kind of verify that these things are happening. Some other things that verbal handoffs improve, it eliminates some patient anxiety, creates a nurturing environment, creates like-minded teams, communication of treatment completed and treatment still needed. I'm gonna go through this a little bit quicker. Front office, okay, here we go, that's what I want to get. So front office is what you guys want to do. Again, front office, you're like that girl in Dutch Brothers, right? That when they come up, hi, how are you? And she's faking it. She had like the crappiest day ever, and she's still smiling at you, and you're like, this is the best day ever. But it really isn't for her. But you'd never know that because she's acting, right? So sometimes it's hard to do. Are we all super happy every day when we come to work?
No.
No. It's just not the way it is.
Whatever, bro. It's a great day.
Good. But our job when you're here, and what I'm paying you to do, we're paying you to do, is to be here and smile and be happy, right? You're here to serve your patients, so you have to act that way. So like we talked about Selena, you want to stand and greet the patient. Welcome to our practice. I want you to shake their hand. I want you to have a name. I'm Selena. Nice to meet you. Thank you for coming to our practice. You must be Mr. Jones, our new patient. Here's some new patient paperwork. Why don't you go ahead and fill this out? Have a seat over there. There you go,
Would
right?
you like a water? You know, whatever.
Yeah, there's water here, there's bathroom inside if you need it, right? And then once you get that, you're gonna tell the clinical team that they're done. Do you guys change the color
Yeah.
on Dentrix?
And then we hand the paper to them so they know. Are we doing that stuff?
Okay.
If I'm
Clinical
doing
team.
tours, I don't know.
So you same thing, clinical team. Amy's gonna walk up and say, hi, Mr. Jones, nice to meet you. I'm Amy. I'm Dr. Pope's assistant. I'm gonna take you back today. Thank you for coming to our office, right? And you're just gonna shake their hand and say, thank you for coming in. You're just gonna introduce yourself. That's all it takes. It takes a smile, a name tag, a handshake. Too often, all I see is they just come out and they're like, when it comes out the paper, they're like, Bob Jones. And they just sit there and wait, and they're just like, they're bothered because they're already behind today, they're not having a very good day. And that's just not conducive to what you want, right? You need to smile, be like, Bob Jones, are you here?
My brother's so funny. You're the cheesiest person.
Run out the door at that point.
So you guys just need to be really smiling, right? And it's almost like flirty, right? You just need to be smiling and happy and be really happy to see him, right?
Leah is really good at it.
Yes.
Go, girl.
Yeah.
Yeah.
Wrong Leah.
Oh, sorry, Leah. My bad. I saw the point
When
there.
you get
Okay,
the
my bad.
patients,
I
you
know
want us to
Leah.
also walk out and greet the patient, like,
Yeah.
if we know
Uh-huh.
who is who, to walk here and, okay,
Yeah.
not just.
So you can say, hi, I'm Kituku, nice to meet you. I'm your dental hygienist. I'll be seeing you today. Come on back with me. Just be nice and greet people, right? Make them feel welcome in your practice.
Like they're your long lost
Well, you
friend.
already shake
Yeah.
your hand already. You already introduced
What?
yourself.
Give him a big hug.
Don't walk.
Try it. Try it.
What's hard about that is you don't know which one is yours.
Yeah.
You know what I mean? Like I walk out and I'm like, who?
You're kind of timid.
No.
Yeah, you're
So
really
the
like,
next thing is you can do is you can pay
like
them a
really,
compliment,
really like timid.
right? Oh, hey, those are really nice shoes. I like those. Oh, I like your nails. Oh, that's a cute necklace. Where'd you get that? That's a peace sign. I like that.
Just kind of like what I did when I came in.
Right. Try and find something to compliment them on, right? Even if you're lying through your teeth, I just love your necklace. It's the ugliest necklace ever, but I love it. Right? Just smile and say something nice about it, right? No matter what it is.
That's like what I
All
say
right.
to all the old people. I love that
After
shirt.
seeing the patient,
I'm like,
after
oh my
seeing
God.
the patient, I guess if this is a new patient, you know them already, it's different, right? But if it's a new patient, I like to get eye level with them. Like we talked about yesterday, when you're trying to do new patient exams, just get eye level with them, get to know them, sit them up, build a little relationship with them, right? You can, okay, make patient comfort emotionally. When you walk them back too, give them a little tour. right? Welcome to our office. Here's, Lori, you did this perfect, right? So Lori, why don't you tell us how you do that? She always does it. She does it really good. What do you say? You say the same thing every time.
I say something every time.
Okay, so give us your spiel.
Okay, so after I greet them and shake their hand, come on back with me. I just want you to know that this is our office. Over here is our restroom. Anytime you need to use it, feel free. You don't have to ask the front desk, just come and use the restroom. And then I'm just going to show you, we're going to go this way. I just kind of show them. This is where we do our sterilization here. It's all OSHA standard here. And this is our consultation room that we just passed so that we have privacy to talk over treatment. And this is our lab where we make our custom fitting whitening trays. And then we're going to go ahead and we're just going to start here. And in that little bit of time, I've told them a lot. I've told them our office is OSHA standard, that where the restroom is, you know, and I've told them that we do the custom whitening trays and all of that within minutes. And then they know all of that.
And it's something that
And then-
seems so dumb to us, right? Oh, custom whitening is a big deal. But to a patient, it's just the little thing. Yeah.
Yeah.
I
And
had
then
another
we'll-
office walk me back. I did a play in another office of a doctor that's going to be doing some coaching for us. And we walked back and he said, and his patient care coordinator said, this is our sterilization area. When we send out spore strips, we send out strips every week to have everything monitored for your safety and health. We do that too. But do we highlight those things? Patients don't know. So if you bring it to their attention, then they think you're exceptional. Even though you're just doing what every other.
Are we sending those out every week? I saw
We
your
need
eyes.
to order them.
She ordered them.
Oh,
Oh, did she?
Okay.
Okay, all right, good.
Right.
For the ortho room, you're telling them you do ortho. Or the sedation equipment, this is where we do our sedation. Any little thing that you could say in that brief
can
amount of
highlight.
We
time.
offer sedation to make it more comfortable for the patients.
That's what I'm thinking. I'm gonna have
Her
to take like
room's
a
right
whole
here.
big loop
Good.
around.
Take them
It's
all
a
around.
beautiful office.
Go all the way down, back, around.
Tell them around.
Do it. Your hygiene chair's over there, just go that way, all the way around.
Go
Well, no, mine's like right there, right.
I know, but
Oh,
go
you're
the
on the
opposite
right,
way.
right, okay, all right.
You can show them, say, here's our consultation area.
Oh yeah, take them
Here's
Leah's way.
where's the doctors work out of. Here's our sterilization area we send out every week. We send out to have all our equipment tested for your safety. Something real easy like that.
I would suggest that everything you tell them matches with some benefit to them. Right, so remember, you guys know all the dental jargon? They don't. So even like OSHA standard, I don't know what that means, but
Yeah.
the highest standard of sterilization or whatever, that makes a little bit more sense to them. So try to reduce the jargon.
He's right, that's
And-
better.
and
That's
match-
better than OSHA.
Everything you say needs to match with a benefit to the patient. Like, why is this a benefit to the patient, right? So even words like ortho may not come across,
Yeah.
they may like, what?
We use these rooms to straighten people's teeth in with bracelets.
Braces.
Yeah.
We use this lab to make custom trays for
Yeah,
teeth
really just
whitening.
dumb it down, but also make sure that's
We
right.
offer sedation to make it much more comfortable for the patient if they're nervous, or however you want.
Exactly.
However you guys want to highlight it, right? Give it up to you, but you get the point. You can start incorporating little things like that as you walk them back. Okay, so clinical team to the doctor. Doctor enters the room, so now we're gonna have a handoff from the clinical team to the doctor, right? So that's how you guys are gonna greet your patients, bring back. Now you've done your exams, now you're gonna go to the doctor and you're gonna say, bring the doctor in. Doctor enters the room, assistant or hygienist should introduce the doctor to the patient using the patient's first name. We talked about that yesterday, right? Important people are always introduced. So you want to say, Mrs. Jones, this is Dr. Pope, right? He's going to take a look at your teeth today.
Using the patient's first
Right.
name? Do you call your patients by their first name? Or
This
by
is Carol.
Yeah. What do you do? You have a preference, one or the other?
We have Carol, or whatever the hygienist tells me is what I say.
All right.
I don't know.
Hi, Bob. This
Yeah.
is Miss Jones. Hi, Miss Jones.
Yes,
Okay.
yeah. Right? So then the assistant or the hygienist should repeat what you guys, because you're going to sit down with it. So if it's hygiene, you're going to take them back. You're going to do all your x-rays. You're going to do your periodontal assessment. You're going to probe everything. You're going to have a conversation with the patient, right? Then you're going to have the doctor come in. You're going to say, Mrs. Jones, this is Dr. Pope. Dr. Pope, this is Mrs. Jones. Hi, Mrs. Jones, nice to meet you. And then he's going to sit down, right? He's going to sit down. He's going to build a little bit. He's going to sit down eye level, build relationships with the patient a little bit. Then he's going to say, and then he's going to transition and say, why don't you, Lori or Katie, you guys have been talking for a little bit. Why don't you tell me a little bit about where you guys are at? Tell me what you guys have discovered so far, in the last hour. give me an update here, right? And then Katie can go through and start giving you a rundown on things that you guys have talked about. Well, here's her history, this is what I found, here are her clinical findings, here's her restorative concerns, here's her cosmetic things that we've talked about. Just kind of shoot down that list of things, okay? And then in the end, Brady can say, okay, thank you for that update. And then you can say, and Mrs. Jones, why don't you tell me a little bit about your long-term goals with your teeth? I always get that question in there somewhere, right? I'm gonna ask that question. So you're gonna thank them for that, and then you're gonna say, tell me about your long-term goals with your teeth, and let the patient talk a little bit, and then you're gonna say, okay, we're gonna take some photos. And then we go in and take some pictures of their teeth. And then I'm having more conversation with the teeth. Right, Lori?
Yes, right.
Is that pretty much?
This is all in an hour?
Yeah.
That seems like a lot.
So I'm making sure that I have this.
It'll flow.
It's an hour.
What has the hygienist done up to that point before I even come in the room? That full like exam and prophy?
Medical history, I think.
Medical history, she's already done the prophy and everything too, Jared?
Yeah.
Prophy, everything, this is a new patient exam.
Oh, new
We're
patient.
imagining.
Yeah.
Yeah.
Okay, all right.
Yeah. And again, even if they have periodontal, you can still do the prophy P before the doctor comes in.
Is there an FMX at the new patient exam every time? You've done all that and a pan? though?
Usually-
We're gonna get a panel in?
Are you
Usually
gonna get a panel?
It's an FMX.
Just an FMX?
I
Okay.
put if they're eligible for an FMX or not in their appointment, so the hygienist
Jason,
know.
New patients, they're taking an FMX regardless, and if it doesn't get paid for, she
Yeah.
downgrades it.
We're gonna take an FMX. Every new patient you want an FMX. It's a liability thing too. You just want to have an FMX in every new patient.
So I have 2 new patients on my schedule tomorrow. Do you want me to start in?
We're not in
implementing-
No, nothing until Monday.
Nothing? Okay. Not even the pictures?
Not till Monday.
Okay.
Wait until you're with Dr. Pope. Wait until Art's not gonna do all that stuff. He's gonna know any of this, right? It's not.
He's a loss.
It's not.
Let him exit with what he's used to as
Yeah.
well. He'll feel better about it that way too.
Okay.
Do you still want, let's say a new patient came in, but they brought their FMX or they emailed us their FMX that was less than 6 months old? Are you still wanting to do another FMX on them, or you want?
Yeah, we
will
can
you
probably,
use-
if it's
If
emailed
it's
to us, we
legible.
can import it actually into Dentrix.
Yeah, we'll use, every
But
new
how
patient's
old
on
As,
this-
as long as I feel like I can see an
Diagnose,
proximal and if it's
Okay.
if it'll work for diagnosis, then sure. What was the word I was looking for? Diagnostic. There we go.
Okay, now let's go from, I'm just skipping a little bit here, but clinical back to the front office. So clinical, once you're done, when doctor's all done with, your guys' visit or hygiene, whatever, now someone's gonna walk them up to the front, right? When everything's been set complete, you should be doing a verbal handoff. Who's up front, who you need to check out with usually? Selena?
Either one.
Okay, so when you're checking out, you should be able to look at, there's a lab case for you guys.
Hey, come on in.
Hello.
Fred?
Hi. Thank you.
And there's gonna be,
Thank you.
there's stuff that's set complete already, right? There's stuff that's set complete. You guys should be able to look at what's been set complete, and with the patient there, right? Assistants are bringing that patient up, and you're gonna have a verbal conversation, you're gonna relay to Raquel or to Selena exactly what happened, what you guys did back there. So you set it complete, but you wanna verbally confirm that with them, because sometimes, it happens quite a bit actually, if you do this right, you'll find out you missed stuff. You didn't post that complete, that gingivectomy, or you didn't, right? There's something that you'll convey to her that she won't see on the computer screen. So you want them to go down and you just follow on the list. That everything that she's verbally telling you, you see in there, right? Do you guys follow what I'm saying? It's kind of a double check method.
Pretty much what we do already.
Good,
Yeah,
perfect.
well, sometimes we're not face
Are
to
we gonna have
face,
the
like.
routings, are we doing the routing slips then?
Yeah, we're gonna do routing slips. We're gonna do a test. We're gonna get everybody together here in just a minute with routing slips. So this might look like Gloria, Joy did great today. We did a root canal, so it's gonna go Raquel. Joy did great today. We did a root canal, built up the crown on number 31. Her next appointment is scheduled in 3 weeks for the delivery of the crown, and she has a recare appointment scheduled in September, right? So you're telling them all that information. You did a root canal, a build up of the crown, and I've got a recare appointment scheduled. Dr. Brulette has now met Doctor's next concern, Dr. Pope's next concern. Wanted to see Joy back for the upper left side. I already have her scheduled for that appointment. Best, right? Best that you guys already did that in the back. I already have her scheduled for that appointment on this date. done.
Okay, I got it.
And then you can just hand off and you're done. You'd be done at that point, right? The front has it from here.
So they're scheduling appointments now, because before they would.
Well, everybody schedules
Okay.
appointments. If it can happen in the back with the doctor, or with the hygiene team, if you have a healthcare provider scheduling that appointment with that patient, they're more willing to schedule directly with that healthcare provider. Okay? So doctors just carry a little bit of weight in helping those patients schedule those appointments. It's a little bit different. So if you can make it happen there, we like to just do it there. So Jess and I schedule a lot of appointments just right there chairside. Lori and I schedule a lot of appointments just right there chairside. If it doesn't happen, for whatever
Like
reason.
what, while they're getting numb or anything?
Yeah, I don't know. I mean, if not already scheduled, if doctor feels it's urgent, or if you have any info to share that would be helpful so patient will schedule, please say this. You know, I didn't have a chance to schedule them. Could you please help us get Joy scheduled for the treatment on the upper left side? Doctors can still concerned about. Our patient had some financial concerns, so we didn't schedule the appointment yet. They'd like to talk a little bit about what their patient portion would be on the upper left side before they schedule. Right? It's just kind of keeping everything in line so that nothing falls through the cracks, right? Yeah.
Plus, the patient is hearing it how many times? It's reinforcing what they need, reinforcing what the doctor's concern is. Wow, it must be pretty important because I've heard it now 2 or 3 times. It gives it time to sink in.
So when you diagnose on a new patient and you create the treatment plan, are you giving them the entire treatment plan or first visit, what you recommend? Lower right side, like priority?
We'll give them the whole treatment plan. How they execute on that treatment plan is very different patient to patient, depending on their
And doctor to
finances.
doctor.
And, yeah, I'm gonna suggest to them, when they have a large treatment plan, I tend to do a lot of it all at once under sedation. So I try and offer that one-stop solution, and I just tell them that we're a sedation certified practice office. What that means to them is that I can give you a couple pills, I can make you sleepy, we don't need to use an IV, nothing like that. I can schedule out a morning with you, just with you and I can go in there and I can get all your teeth fixed for you, right? You wake up at home, well, pretty much everything's done. Then we have to come back for some deliveries of crowns or something, right? Or at least we can get a significant portion of that done. So a lot of our patients will choose that because it's very convenient for them and allows them to get a lot of dentistry done in one visit, right? I would encourage you to consider that, right? It's easier for me and I think it's easier for you.
That's what most of our patients choose to do.
Yeah, that's what a lot of our patients like to do. That's a perfect one too. That's exactly right, consensus. So I just use that language a lot. Now, if they go up front and Raquel says, okay, it's $8,000 and we can run care credit, they're more likely to see, because of that sedation, they see it as a medical necessity. They're willing just to finance, like I've already discussed with you guys, they're willing just to put up more money and finance a bigger chunk of their treatment if you can offer them a one-stop solution for all that treatment. They're just more willing to do it, right? Yeah, I don't know how to explain it, but they just will. Right, Lori, you see that too?
I see it all.
And with Joy sees that, it's just easier when the doctors are doing that right to close bigger cases. But they may come up and say, I just want to start with one tooth at a time. Fine. Then you may have to go back and say, Dr. Pope, you guys have everything on visit one, because the patient may in the back say, sure, I'd like to do it all at one time. So we put everything on visit one, and they go up front to her, never mind, I didn't think it was gonna cost $8,000, so I only have $1,000. Okay, well, hey, Dr. Pope, then I have $8,000. I couldn't get them through care credit. I already ran a care credit report or application, couldn't get them qualified. What do? They can only have $1,000. Well, let's do this tooth first.
Well, let's start with the one that's most badly broken
He
down.
has to tell you that. He has to tell, these guys have to tell you.
Because I'll know what priority is
Yes.
in that treatment plan.
So is your assistant creating the visit in the treatment planner or just off of the?
You guys are gonna have to talk to them. So they're gonna tell you, they're gonna diagnose everything that needs to be done. As he's telling you and he says, hey, Mrs. Jones, we're a sedation certified office. You have these teeth in there. You need a deep cleaning, right? You need to come back for a 2-hour visit with our hygiene department. Because you're gonna be here, you're already gonna be numb. They're gonna have to see you for 2 visits. What we can do, I also need to see you for some crowns or a root canal or some fillings, right? What a lot of our patients will choose to do is they'll just choose to kind of go to sleep. We're a sedation certified office. we can give you a couple pills, you can go to sleep. So what'll happen is you come in and see Katie or whoever, Rachel, and they'll do your deep cleaning for you. You already be numb, you'll be here asleep. Then I'll come in and I'll go ahead and do all your fillings and your crowns, and then you wake up at home and you're done. So if you can do that, that's gonna be the best way, the most comfortable way for you to get your dentistry done. I think that's in your best interest. If that's something you would like or can do, I think you should do that.
But when you're giving us what they need and we're inputting it in the computer, the way we did it before was we wrote it down and then we'd leave while he's talking and go input it
They
and
just
then let
input
them
it. You should be
know.
able to input it chair side. We'll have quick buttons, you should just be inputting as we're talking.
Okay.
So as they're up there on the
You
screen.
heard 4 o'clock
But
with
it's just-
SRP and you're clicking on it. You heard, oh, you'll need a root canal build and crown on this too, click on it.
Yeah,
Is
but
that
it's
right?
it. I'm just
Yeah, you
asking
don't wanna
that
say 4
in the
o'clock. You
treatment
wanna say,
planner, because right now he made it seem
They
like
have to watch all your
appointment
numbers.
one,
Again, verbiage that I
which
have
is
to write.
going into the treatment planner and creating the appointment. We just need to put it in there. They create the visit.
Like 1, 2,
Yeah.
3.
Yeah, okay, that's what I was wondering.
You treatment plan, and based on what you're hearing them say,
Yeah,
when he's up on the TV, he says, I'm concerned about this tooth, it needs to build up
Yeah.
on the crown, this tooth needs a sealant. You should be treatment planning that, that's him treatment.
Yeah.
That's him they're
You don't have
treatment
to
planning.
put treatment, like let's say.
Visit one,
Visit
yeah,
one,
two.
do they have to put it in order? Do they have to
You
phase
do,
it?
you need to put it, you
Oh,
need to
yeah.
phase it, you need to put it in order.
Phase it.
But if he sits down and says, if he's sitting there talking to him and says, we can do all this at one time, you guys know that deliveries are visit 2. You know that abutments are visit 2. You know that implant crown is visit 2, right? You know if it's a partial, there's gonna be impressions and then try-ins and wax try-ins, right? You guys have that phased out, so there's obviously gonna be multiple visits. You guys will just put those as they should be, right? Do you guys, am I answering your question?
Kind of. I kind of know how to do it, but she would have to kind of be, it's easy
Well, I know how to put everything in order in the treatment.
in the treatment plan.
She's been starting to do
Yeah.
it.
You guys will have to order that. If you have questions, ask the doctors. So what's first? What do you guys
Yeah.
think?
Yeah.
But a lot of it's gonna be as you have to listen to what they're talking about. Because if the patient's like, yeah, I think that would sound good, that sounds good, then you'd say, okay, you just put everything in visit 1, right? All the work.
Or if they hear right then, that,
Yeah.
no, I don't think I want to do the sedation, this, that, or that, I'd rather split it up into a couple of visits.
Yeah.
Okay, then what we'll do is we'll start up here, we'll start up on this section of your teeth, now you already know how to start phasing because you're hearing us
Yeah.
explain the sequence.
So what about so as far as hygiene, because I have no assistant experience. So putting in the treatment plan, I guess.
I can enter the treatment, it's just like,
We don't do
everything
phases
down.
and priority,
And
other than our
I
note.
mean,
That's where I
I
was
know
priority
the tooth
upper
is a
left
priority, I can
second.
put it
I mean,
in.
if I come in on a hygiene check or an exam or something, and there's work to be entered in,
I know how to do that, but I don't know how to do the treatment
Phase 1,
planner,
phase 2, phase 3.
Yeah.
That was all
We need
verbal,
some-
that was all
Sounds
verbal
like
for
we need some
us.
training on that.
It's
then
just not
we'll-
open on our computer.
It's
Yeah.
easy once you
Okay.
get it, but it was all verbal.
Yeah.
show you, it's easy.
Okay.
It's not open on.
We will
our
need training for the
computer,
next
'cause
2
there's
years.
a treatment plan that will pop up.
We'll need
and then
training
you
for the
just
next 2
right-click
years.
it, and then it pops
It's
up, like,
ongoing, right?
move to
For
visit
the
one.
next year.
Yeah.
Yeah.
You just highlight it.
Someone will have to show.
Yeah.
Yeah.
It's just like, dude, that's never.
Our screen just.
And you can
needs
talk
to
about it,
change.
but to actually
Yeah.
get it to stick and become a habit,
Treatment plan, or what-
Oh, yeah.
it's a hard one too, right? Takes a long time just to integrate. So there's a lot here, it's just gonna take you time to get all this figured out, right?
That's what I was wondering, if it was verbal communicated, phase 1, phase 2, or us actually
Yeah.
putting it in.
And then he'll tell you
Well,
1,
it's
2,
both.
3.
They're, if you know, if you listen,
Yeah.
you're gonna have to listen to them,
No, that's
what
not,
they say.
just between us,
We
front
did it
and
different.
back, just
took
because we did it
notes, like,
verbally and
First,
we knew what the
you know.
priority was, but we didn't prioritize it for the front to
We did it
present it.
It's super, super easy, just a couple.
really
I mean, I don't see, it'd be fine if Dr. Calloway's talking about a treatment plan or something, if one of the assistants said,
Oh, yeah.
would that be for phase 1 or 2, or?
No,
I
we
think
know
they
that.
interject in
We
between,
know
right, and
that.
ask questions.
It was just the verbal communication from front to back, is what was my question.
we'll get it handled.
Yeah.
Cause it'll be in there, you guys should even see it, it's ordered. If you order it in the back, they'll see it in the front.
That's what we're saying, some of us don't know how to order it, but they'll teach us.
Yeah.
Yeah.
Yeah, we'll teach you guys.
We'll
Yes.
teach you how to, it should be ordered in the
That's
back.
it.
The front has no idea what the heck's going on in the back. So the only way the front has any idea of what's going on is if you guys all order. That's all our job in the back, to say, here's the order of how things are gonna happen. But again, they may get up and talk to Raquel and it's gonna change. Most of the time, it doesn't happen like Brady said, oh, I'd rather do this in parts and sections. If you're good at what you do, most of them are like, oh yeah, that sounds great, I'll get sedated and I'll just come and get all my dentistry done, right? They like that, right, Lori?
They do.
They really like
Like
it.
it all done.
But then they'll go up and talk to Shannon, or talk to Shannon's our office manager there at that practice, right? I still work there on Mondays. When Shannon will go through the treatment plan presentation with them, and then again, it'll be, it's too much. And then they'll come back to me, Shannon will come to me and say, Dr. Pope, I can't get them calling care credit, they can't do the $5,000 or $20,000, so what should we do first? We gotta phase this out. And then, so I'm taking them down the stairs, I'm giving them the ideal solution first, and then we're gonna go to plan B.
But by now, the patient's already up at the front. How do you now meet
Yeah.
the patient? Do you meet the patient here?
Or do
Do
we
they
put it
now
back
go
in a
into a
room?
consult
I go
room?
back and talk to the patient. I go into that consult room usually, or if she has them in a chair and she's talking, like go back to wherever the
Oh,
patient's
because
at.
sometimes she has come to the back or okay, to talk to them about
If
it.
it's a
in the
larger
chair.
treatment plan, they're usually, if it's sedation and a larger treatment
They're in the
plan,
chair.
they're in that presentation room.
Okay.
Because I want to be comfortable. I don't know, how often was he diagnosing and presenting $10,000 treatment plans?
Never.
Was that happening very often?
Yeah. There were scattered treatment
But you're gonna have
plans,
to go
but they
through,
were
you're gonna have to
there.
go through care credit, right? You're gonna have to talk about their finances.
We never
you have
used the
to-
consultation room, but we should have.
We should,
We should.
standing up at that window
Yeah,
is
don't,
so
I don't want
embarrassing.
them to do that. So they need to sit down in those chairs back there, right? Raquel or Celine, you guys need to go into that room, run care credit there with them. Shut the door so it's private, so you guys can talk about things, right? You can't close big case dentistry unless you have a nice environment to do it in, right? You don't go to buy a Mercedes and they don't just make you stand at the counter the whole time and you're signing all your documents, right? Let them sit down, let them relax and go through it with them.